COVID cases and hospitalizations rise around not only the valley, the state, the nation. And also, I was reading how some children are in hospitals with COVID, and that the Delta variant, that they're seeing a rapid spread of Delta variant in children. Joining me on News Talk 710 KURV is Dr. Farrah. She is a cardiologist. Doctor, thank you so much for joining me. Now, first, let's talk about COVID-19's impact with the heart. What's the correlation there, if any?
Certainly, yes. First of all, thank you so much for having me on your show. It's a pleasure to be here. Throughout the pandemic, over the course of the last year, we've seen quite a few patients affected by COVID and cardiovascular disease. So people who have existing history of cardiovascular disease, they're usually at a little bit higher risk of having more adverse impact from COVID. Their mortality rate is a little bit higher. On the other side, people who did not have pre-existing coronary artery disease or heart disease, we are seeing increase in heart disease as a result of COVID, even in young patients. One of the really common things we're seeing is arrhythmia, particularly atrial fibrillation. I've diagnosed several patients with that as they were recovering from COVID, even as young as 30s and 20-year-olds.
So this is, just to kind of recap, those people who have already had, heart problems, if they catch COVID, it's a little bit harder for them. They get it more severely, and in some cases, it's a higher chance for them to pass away of COVID. But you're mentioning that if you have no heart conditions prior to catching COVID, that now you guys are seeing an increase in heart disease in patients who are recovering from COVID.
That is correct. And even the patients who, as they're going through the infection, as they're fighting the infection, those who have higher risk factors like diabetic patients, hypertension patients, they're at a little bit higher risk of plaque rupture. In other words, they didn't have known blockages before, but they had plaque that was there. And the stress of having the virus, the infection, can cause that plaque to rupture and can cause people to have heart attacks. So people who are having COVID-19, they're at a slightly higher risk of having heart attack, heart failure. We've seen lots of cases of heart failure, stress-induced cardiomyopathy, things like that as a result of COVID. COVID is also causing something else called myocarditis. It's an inflammation of the heart muscle. Yeah. This has been seen both in younger folks and older folks, where it causes inflammation of the heart muscle and can cause chest pain, can cause fluid to build up around the heart. So lots of symptoms and things like that.
I mean, you might not have the answer, Dr. Farrah, but the percentage of people who are currently or who have gone through any type of heart conditions after getting COVID-19. Is it a lot, a little bit? I know we might not have the exact number, but in your practice or what you've learned, what you've read, what you've studied.
It's a fair amount, and it's a mixture of real heart disease, people who truly have been impacted by COVID-19 and they truly have heart disease as a result of it, in certain conditions like atrial fibrillation, heart failure, and even some who have sustained heart attack as a result of it. Those are true. Those are real. I don't have an exact number to give you. We still don't have that data. But when I said mixture, what I mean by that is that we've also seen a fairly large number of patients who came in with symptoms of chest pain, lots of chest pain patients. And, they didn't necessarily have, after they underwent the necessary cardiac workup, a lot of them had normal outcome, meaning they didn't really have any blockages or anything like that. So there's an anxiety factor as well that's leading to a lot of heart conditions. People are afraid. So there's that as well.
I think a lot of people went through a lot of anxiety last year too, and just I don't know if the pandemic triggered it. And I think I've never gone through anxiety. I've never had panic attacks, but I know people in my circle who have experienced them, and it is just so heartbreaking to see them go through that and not know what is going on. And any little thing, if it's, if your heart skips a beat or if palpitation, whatever it is, they automatically just get these attacks, and it might make it worse if they were to catch COVID. Another reason why we wanted to talk to you today, Dr. Farrah, my guest on 710 KURV, is the Delta variant. It might be too early to even know or to study if the Delta variant might have a different effect on those people when it comes to the heart if they catch the Delta variant after recovering from COVID-19.
That part is still quite not known.
Yeah.
Although we do know that the Delta variant is very much here. 60% of our new cases in the U.S. is Delta variant. So that is our major variant right now across the nation. And we do know that from the Delta variant that it is far more contagious. And unlike the other variants we've seen, this is not sparing the younger generations as much. Like younger folks are getting this just as much. We've seen it in India. We've seen it in other parts of the world. Many young people have died from this, so they're not quite as resilient to this variant as the previous variants have been.
That is just, you mentioned children. And I know that luckily, since the beginning of this pandemic, children really haven't been impacted with COVID-19 or by COVID-19 as much as those in, the older population. And I remember reading that in some cases, the flu or the upper respiratory illnesses can be more deadly for children than COVID-19. But you're saying, and it's not just you, a lot of doctors are saying that with the Delta variant, they're seeing more children in the hospital and just a rapid spread of Delta variants among children. What should parents do to protect their kids if they choose to maybe not get them vaccinated, or if they're too young to get vaccinated? What tips would you give parents?
My advice is going to be, of course, alongside what we've been saying, mask. Mask is, prevention is key. Masking is still important. I know we've relaxed our, in the U.S. we have gone through a little bit of relaxation of masking, but with the Delta variant, I do think that it's important for, especially those who are not vaccinated, to continue to wear masks, especially children, like the groups you said, who are not qualified to vaccinate, who are younger and not eligible for vaccination. Very important for them to maintain those precautionary measures, continue to wear masks, wash your hands, avoid crowded areas. Those would be very important.
You mentioned masks, and I know that it has become a political symbol, and it's just so sad how everything now gets polarized and politicized anyway, but I guess the question is, if people are vaccinated, should they still wear masks? Yes, no, and if yes, why?
And I know there's mixed answers out there.
Yeah, there is. There's not a right answer, Dr. Farrah, I know.
Yes, there's not at this point, especially because of the guidelines CDC has been giving. It's been a little bit confusing for a lot of people. In my opinion, yes. Even if you're vaccinated, in the rise of this new variant, I think I'm somebody who is more cautious. I'd rather be safe than sorry. That's my motto. And simply because I've just seen so much devastation in the front lines from this virus, just lives being lost in front of me. And from that standpoint alone, not for any political reason, just for the purpose of saving lives and not go through another wave to prevent that, I think a simple thing like wearing a mask can go a long way, regardless of vaccination or not, just because of this new variant that we're having to deal with right now.
Yeah, I know that I've heard, and I'm pretty sure you have heard too, and might even agree, that COVID-19 is here to stay. It isn't really going anywhere. And maybe a concern for doctors like yourself, cardiologists, is the different variants that are out there. I know right now the talk is Delta, but I've also heard of one called the Lambda variant. And I spoke to a doctor, I think 2 weeks ago, and he said that the Lambda variant is even worse than the Delta variant. And it's just like, wow, my word, how long are we going to be having this discussion?
So you brought up a very important point, and the key to, so first of all, how does virus replicate, right? How do they survive? The way they survive is by infecting as many hosts as possible. They go from host to host to host. And in the event of replicating, they mutate. Their genome, their genetics, the DNA mutate. And that's how we form these variants. So the longer the virus thrives, the higher the likelihood that we're going to keep on coming up with different types of variants, because that's just the nature of virus. That's how they survive in nature. The way to offset that, the key to that is vaccination. The sooner we vaccinate and the more people we vaccinate, the quicker we're going to get rid of the variants and stop at the core, basically stop the virus from replicating. The less host is able to infect, the less likelihood of these new variants popping up.
Before we go, Dr. Farrah, is there anything else, any advice you'd want to give our listeners? Anything they should know about the Delta variant, about heart conditions, anything along those lines?
Certainly. My advice is, very simple. I think what matters most is not to go back to where we were in January, not to lose any more lives to this. It's not about politics or anything. It's about health. It's about public health. Message is simple. Please, maintain precaution. Keep wearing masks when you can. Avoid crowded areas. Wash your hands. Vaccinate. For those who are eligible for vaccination, it's very much a key to prevention for your own health and people around you, and coming out of this pandemic. As far as heart health goes, if you have symptoms or risk factors, regardless of COVID-19, you should talk to your doctor and seek help, see a cardiologist. Additionally, if you are someone who has been infected with COVID-19 and are now symptomatic with cardiac symptoms, the strong advice is that you see a cardiologist and get a cardiac workup done to make sure everything is good.
Yes, ma'am. Dr. Farrah, thank you so much for joining us and taking time out of your busy schedule to talk to us. That is Dr. Farrah, cardiologist, my guest on News Talk 710 KURV.